Medicolegal associates provide clinical negligence reports for the court for both claimants and defendants, which are fully CPR 35 compliant. The prospect of a clinical negligence claim is not one many doctors wish to dwell on. However, it is inevitable that mistakes will be made in the course of a career, and if a patient suffers harm as a result of negligence, he or she is entitled to claim compensation. We rely on medical practitioners to provide the right advice, care, treatment and aftercare. An incorrect diagnosis or delay in treatment or failure to prescribe the correct medication can give rise to serious consequences for the patient. When I am instructed to write a clinical negligence expert report for the claimant, I will review all of the information, medical records, witness statements, and the documentation relating to the case. I will use this information along with my own examination and diagnosis to confirm whether the diagnosis or treatment your client received fell below the required standards of care. In terms of what you can expect in a report you instruct, I will explain the structure and process of the report. Firstly, a medical consultation is arranged for your client in my Harley Street clinic. We aim to offer this within 7 days of your instruction. Your client will be sent a detailed questionnaire to complete before their appointment. This needs to be completed thoroughly and will take about 1.5 to 2 hours to complete. And we ask them to take time and give considered and factual responses, as this forms an important part of the report and enables them to explain in their own words the impact their pain or treatment has on their daily living, work, socially, and relationships with other people. Your client will be asked to explain in their own words the characteristics of their pain, investigations and treatment they have had or are having. I ask them to complete this information before the examination at their own pace to enable them to focus and report on their pain and condition and how it feels and impacts on them. We also use recognised pain tools in the form of clinical questionnaires to measure their pain, including any depression they may be suffering. The purpose of this detailed exercise is to gather as much information as possible to enable me to build a detailed, informed and holistic picture of your client's life, both pre and post incident. In parallel with this process, I will be reviewing their medical records, witness statements, consent forms and any other information made available to me in detail, and will summarise these together in the report to give a complete chronological medical history of your client, both pre and post index incident or procedure. It's important that the diagnosis, opinion and report that I am able to ascertain their condition before and after the incident to give you a full and informed opinion at report stage of the full situation with your client to provide a current and future prognosis and treatment plan. When they come for their consultation with me at Harley Street, I will review the questionnaire with your client to discuss and clarify any responses I need to. I examine the client in detail, focusing on specific areas but also on any associated or allied areas. Photographs are taken with a high-resolution camera for inclusion in the report for ID purposes, but also, importantly, to capture things like any scars, contractures, colour changes or other abnormalities. I also photograph any medical aids they are using, such as walking sticks or wheelchairs. At this point, with all of this information, I am ready to write my report, and I am in a position to give a diagnosis and opinion on whether the treatment they received fell below the required standard of care. My report will analyse previous treatment your client has had and the outcomes of that treatment. I will advise on future treatment options available to them and possible outcomes, and integrate this information in a structured way into my report for the court. Medications will be discussed in the report, both their current medications and other options and treatment I recommend, with guideline costs. I also give careful consideration to any questions you or counsel have asked me to focus on, including responding to any specific questions you have asked me. The report is finalised with any relevant research, reference and papers or articles if necessary, and delivered to you usually within 2 to 4 weeks of the examination. There may be occasions where no negligence is identified, and if you are unsure as to whether negligence can be proved medically, we can offer a cost-effective preliminary screening report in the first instance to advise you on the merit of a claim, enabling you to agree with your client whether a full report should be commissioned. When instructed by the defendant, the process and focus of the report is very similar. However, it will obviously have a focus and be written with the claim against the defendant under review and analysis.